has been as well one of the toughest years for healthcare workers and the health system. And it's not over, I'm afraid. The COVID-19 pandemic has been pushing them to the brink. They're on the edge. And the second wave, as we've been told, is far from over. Let's discuss not just the medical year, but also how our frontline workers are going to manage through Christmas, New Year's and 2021. Always a pleasure. Chairman of Parliament's Health Portfolio Committee, Mr. Sibongiseni Dlomo, joining us this morning. Mr. Dlomo, thank you for your time. Level 3 is where you and I are now sitting in. A very unhappy, some even saying an emotional President Ramaphosa last night, appealing for the public to do what they can and do what they must to get on top of the situation. But in the end, it's the healthcare workers that are suffering perhaps the most at this time of year.
Good morning, Gareth, and good morning to your viewers. It's so true. Some of us have got choices, but our healthcare workers don't. They wake up every morning not knowing what they are going to meet, where they are going, and some of the people die in their hands, and therefore quite a lot get infected incidentally. So this is a real big call for a behavioral change, unless and until we really take it into our own responsibility as individuals, that it will have to take every single person. Sometimes I drive through and I see some people walking without masks, getting into a big space of a shopping mall. And I come into a shopping mall, I find the shopkeeper not having a mask on. I say, but why are we doing these things? So it has to take that level of a commitment from all of us to protect, yes, our frontline workers, but the rest of the society.
Dr. Dlomo, I would like your thoughts on the now changed timeline for the vaccine. Up until last night, we have all been told it's going to be the first quarter of this year. I imagine you are incredibly disappointed, perhaps even angry, that it's now the second quarter of 2021 to receive the vaccine, particularly because there is the call that frontline health workers will need to get it first, but now we're going to be delayed again by 3-4 months. I'm sure you're furious.
Yeah, Karen, let me just give you this background of my information. You know, there are certain people who have been students and they are healthcare workers who are going to start in the next week. All of them, without fail, will be given hepatitis C vaccine, because that vaccine is so critical, because you actually can die if you handle a patient with hepatitis C. Now, we would have expected the same, yes, that we would really be the frontline country to receive this vaccine. You are correct. There was once upon a time an announcement that it would be available in the first quarter. I am actually also concerned and worried, and as a head portfolio committee, we will probably have to be appraised as what has made a shift in the timelines. But what is comforting is what I heard from the president saying there are also still bilaterals with certain countries, but it looks like this pool of vaccine that is going to be available countrywide, probably from this conglomerate, will be delayed. But what would actually be our interest is to, can there be no other avenue where maybe there are bilaterals with countries that are going to be receiving? Look, we saw this in the PPE also. There are certain countries that prioritize themselves because they've got a dollar and they've got monies in their pockets to really be the frontline recipients of those PPEs in the country, in the world, when there were some deficiencies. So I'm actually hoping that we will also be able to get into certain bilaterals that will make South Africa be amongst the best, the very first country that to receive the vaccine.
Many analysts I've had a chance to speak to, Dr. Dlomo, are saying that if it had been better managed from a financial perspective, this country would have had vaccines on the way much sooner than the second quarter of next year. Some of the critics coming out and saying that it's government squandering money. That's why we haven't been able to get the volume of vaccines and get them in time. What's your reaction to that? Is this bad management from government?
No, not as far as I could remember from the report that we got from Dr. Mkhize in Parliament, where he actually said, thanks to the South Africans who have come up so much into contribution into what we call a solidarity fund, part of what actually has assisted us to access this vaccine, preparing for the access, was the Solidarity Fund, where many South Africans, including some of the parliamentarians, made their contributions. We did meet, there was a bit of a challenge, but we did meet a timeline according to the report that I have, where Dr. Mkhize then made that payment that was due so that we could be part of. But Of course, yes, that was about getting it in the first quarter. So I'm saying, sitting where I am, one is privileged to be a member of parliament. I would be engaging with the minister as to what has actually made us to have a timeline shift in regards to this matter. And it's something that probably, if it needs be, can still be adjusted and be corrected. Yes, you are correct. Maybe me and you can delay getting it, but the frontline workers and those who are working in the security industry are the people who probably should be prioritized first, and our elderly comorbidity citizens in our country.
I appreciate your time in speaking to us this morning. Hopefully you can get some clarity as Parliament's Health Committee to try and find out why it's been delayed again. If Parliament's Health Committee chairperson, Dr. Dlormo, doesn't know why the vaccine has been delayed, there are very serious questions to ask this morning. And on those deaths, 336 more COVID-related deaths reported last night. So the Health Committee chairperson, Health Portfolio Committee chairperson, doesn't know why there's been a delay, but I'm sure we'll find out as soon as we can.